Well, the main argument is that people who are experiencing all sorts of disadvantage have multiple risks. And if you can help them in several different ways at the same time, you can make things better. So for instance, you might have to work with housing to help the family to get a better living environment, while at the same time you're getting the child to have good childcare, for instance, and the parent to have classes to speak more fluently in the language of the country in which they're living. And all of those things can come together with perhaps advice on parenting support and ways to encourage their children to be more independent. Well, the most commonly mentioned one was the bottom-up approach. So local community support and local practitioners believing in this way of working. But almost as important is top-down support, because without that you don't get commitment for the funding and you don't get strong support to be able to be innovative, to take risks. And strong management was clearly seen as very important, that if you didn't have somebody strong in charge who held everything together and could arrange lots of good meetings, lots of communication, those were the things that helped to make this a reality. Some that were less common, although in the literature they're suggested as very important, are things like co-location, because for instance co-location is seen as the ideal to reduce stress for families, that they can come to one place, they can see different practitioners, they can consult, the practitioners know each other and can share information. It was clear from the work that we've done, both looking at the literature and in our successful case studies in 8 different countries, that there are many more barriers to this sort of work than there are facilitators. That you can say that you want to have good management and you can have good information sharing and sharing commitment, but those things don't happen overnight. And even in the successful cases which we studied, they were still facing barriers. One of the most important being that political influences could affect the commitment to this type of working, and also, more importantly, the level of funding available to make this kind of work a reality.